How to identify osteoporosis. Osteoporosis is a common condition that affects millions of people worldwide. It is a condition in which bones become weak and brittle, increasing the risk of fractures. Osteoporosis often goes unnoticed until a fracture occurs, but there are several ways to identify the condition before a fracture occurs. In this video, we will discuss 10 ways to identify osteoporosis. Early identification of osteoporosis is crucial for preventing fractures and improving quality of life, and these tests can provide important information about a person's bone health and fracture risk. Number 10. Bone density testing. Bone density testing is a common diagnostic test used to measure the density or strength of a person's bones. The test can help identify if a person has osteoporosis, a condition that causes bones to become weak and brittle, increasing the risk of fractures. The test is also known as dual energy X-ray absorptiometry or bone densitometry. Bone density testing is typically performed on the hip and spine, which are the areas most commonly affected by osteoporosis. Bone density testing is recommended for women over the age of 65 and men over the age of 70, as well as for younger people with risk factors of osteoporosis, such as a family history of the condition, low body weight, or a history of fractures. The test may also be recommended for people who have already had a fracture, as well as for people who are taking medications that can affect bone density, such as glucocorticoids or aromatase inhibitors. Number 9. Fracture history. A history of fracture is another way to identify osteoporosis. People who have had a previous fracture, especially in the hip, spine, or wrist, are at a higher risk of developing osteoporosis. According to the National Osteoporosis Foundation, up to 50% of women and 25% of men who have a fracture after age 50 have osteoporosis. Therefore, if you had a fracture, it is important to talk to your doctor about screening tests and lifestyle modification to reduce your risk of future fractures. Number 8. Physical examination. Physical examination is a diagnostic tool that healthcare providers use to assess a person's overall health, including their bone health. During a physical exam, the healthcare provider will perform a thorough evaluation of the person's body, looking for signs and symptoms of bone loss or fractures. The physical examination typically includes a review of the person's medical history, including any previous fractures or family history of osteoporosis. The healthcare provider may also ask about lifestyle factors that can affect bone health, such as diet, exercise, and smoking history. During the physical examination, the healthcare provider will also perform a visual inspection of the person's body, looking for signs of bone loss or fractures. They may check for a loss of height, which can indicate compression fractures in the spine, as well as any curvature of the spine, or a rounded back, which can indicate vertebral fractures. The healthcare provider may also examine the person's joints for signs of osteoarthritis, which can affect bone health. In addition to the visual inspection, the healthcare provider may perform a series of physical tests to assess the person's balance and coordination. These tests can help identify any weaknesses or problems with the person's bones or muscles, as it could increase the risk of falls and fractures. For example, the healthcare provider may ask the person to stand on one leg and walk heel to toe to assess their balance. Number 7. Ultrasound testing. Ultrasound testing is a non-invasive procedure that uses high-frequency sound waves to measure bone density. It is typically used to screen for osteoporosis in the heel bone, which can provide an indication of overall bone health. Ultrasound testing is less accurate than DEXA testing, but it is more affordable and convenient. It is often used in primary care settings to identify people who may need further testing or treatment for osteoporosis. Number 6. Genetic testing. Genetic testing is a diagnostic tool that can help identify genetic factors that may increase a person's risk of developing osteoporosis. This type of testing looks for specific genetic variations that have been associated with a higher risk of bone loss and fracture. Genetic testing for osteoporosis is typically performed during a blood or saliva sample, which is analyzed in a laboratory to look for specific genetic markers. The test can identify certain gene variants that have been linked to an increased risk of osteoporosis, such as the VDR gene, which is involved in regulating the blood's use of calcium and vitamin D. Genetic testing for osteoporosis is most useful for people who have a family history of the condition or who have experienced unexplained fractures at a relatively young age. The test can provide valuable information about a person's genetic risk factors for osteoporosis and can help guide decisions about preventive measures and treatment. However, it's important to note that genetic testing for osteoporosis is not a routine diagnostic tool and is not recommended for everyone. While genetic factors can contribute to a person's risk of osteoporosis, lifestyle factors such as diet, exercise, and smoking habits are also important contributors to bone health. Therefore, genetic testing should be used in conjunction with other diagnostic tools, such as bone density testing and physical examination, to provide a comprehensive evaluation of a person's bone health. Number 5. Computerized tomography scans. CT scans can provide detailed images of the bones, including the spine and hip. CT scans can be used to evaluate bone density and detect fractures. They can also be used to monitor the progression of osteoporosis and evaluate the effectiveness of treatment. CT scans are not typically used for routine screening for osteoporosis, but they may be used in certain situations, such as when a person has a high risk of fractures or a recent fracture. Number 4. Quantitative computed tomography. Quantitative computed tomography is a type of CT scan that can measure bone density more accurately than standard CT scans. QCT scans can provide information about the density of specific regions of bone, such as the hip or spine. This information can help doctors identify osteoporosis and monitor the effectiveness of treatment. QCT is typically used in research settings or in specialized clinics. Number 3. Spine X-rays. Spine X-rays are a diagnostic tool that healthcare providers use to assess a person's bone health and identify signs of osteoporosis. These X-rays can provide detailed images of the bone in the spine, allowing healthcare providers to look for signs of bone loss, fractures, or other abnormalities. During a spine X-ray, the person will lie down on a table or stand against an X-ray machine. The technician will position the X-ray machine so that it is aimed at the person's spine and will take several images from different angles to create a complete picture of the spine. Spine X-rays can help identify a range of bone health issues, including vertebral fractures, spinal deformities, and loss of bone density. Vertebral fractures are a common complication of osteoporosis and can cause pain, limited mobility, and other symptoms. By identifying these fractures early, healthcare providers can develop a treatment plan to manage the pain and prevent further complications. In addition to identifying vertebral fractures, spine X-rays can also help healthcare providers assess a person's overall bone density. Loss of bone density is a key feature of osteoporosis and can increase the risk of fractures. By measuring the density of the bones in the spine, healthcare providers can assess a person's risk of fracture and develop a treatment plan to prevent further bone loss. Spine X-rays are generally safe and painless and do not expose the person to a significant amount of radiation. However, they are not always the most effective diagnostic tool for identifying osteoporosis, particularly in the early stages of the disease. In some cases, more sensitive imaging tests such as CT scan or MRI may be necessary to provide a more detailed evaluation of the spine. Number 2. Dual Energy X-ray Absorptiometry Vertebral Fracture Assessment. Dual Energy X-ray Absorptiometry is a common test used to measure bone density. DXA can also be used to identify vertebral fractures, which are a common complication of osteoporosis. DXA Vertebral Fracture Assessment uses a DXA machine to take X-rays of the spine to identify vertebral fractures. This can be useful for identifying people who may need further testing or treatment for osteoporosis. Number 1. Serum calcium and parathyroid hormone levels. Serum calcium and parathyroid hormone levels can provide additional information about a person's bone health. Parathyroid hormone helps regulate calcium and phosphate metabolism, which are important for bone health. High levels of parathyroid hormone can indicate bone loss and an increased risk of osteoporosis. Low levels of serum calcium can also indicate bone loss. Blood tests can be used to measure these markers and provide more information about a person's bone health. And with that being said, it's time to end our video. Subscribe to our channel for more amazing videos like this. We'll see you with another interesting video.